Claudia, is there any treatment for stretch marks on legs? They're quite deep on my upper thighs. Stretch marks are tricky, I have to say. You can get some improvement with plasma pen.
Plasma pen's good.
Yeah, you can get some improvement with plasma pen. You can get some improvement with the topical skin products as well. But yeah, let's have a look and we'll see.
Microneedling, plasma pen.
And PRP as well.
PRP.
Thanks for mentioning microneedling. That's good.
Yeah, there are a few options.
PRP,
coming in. It's worth knowing, you know, at what stage your stretch marks are as well. Are they red? Are they white?
Yeah, true.
Yeah.
Early on stretch marks, if they're happening, I once had a patient who'd had a breast augmentation, and she called me up and said, I think I'm getting stretch marks. I said, okay, you know, when did it happen? And she said, yesterday between about 4:30 and 5. What? And she said, well, I'm spending quite a lot of time looking in the mirror. I really like them. And at that stage, we can actually prevent them progressing. You can't undo, but you can, you know, support. So that's worth knowing about really early on. If they've happened, then there's various things we can try. Now, that brings me on to the topic, because when you guys answer the phone, a patient calls up and they say they'd like a consultation, and you very rightly say, what's it for? And I know that when you call up the receptionist at the GP surgery and they say, what's it about? You know, people don't really like that.
Yeah, people kind of go,
it's none of your business. It's my
It's my doctor.
And at the end of the day, you're going to see the GP whatever happens, I think. So I don't know why that's necessary. For our purposes, it is really helpful because
some of these things are time sensitive.
Yeah, so it can. Yeah, so sometimes time sensitive. Sometimes it can direct you to one person rather than another. Sometimes you think you might want to see, for example, me, but actually, if it's about stretch marks, I would direct you to Maxine or Jenna first, because their knowledge of the topical products, PRP, microneedling far exceeds mine. So it's a really helpful way just to you know, it's fine if you end up, we all work together, we all work as a team, so we will send patients in various rooms, but it will just be more efficient from your perspective. And sometimes it's helpful to see more than one of us at the same time. So we might say, why don't you see, for example, me on a day that Jenna is available, and you'll find a day in which we have back-to-back slots with both of us, both in at the same time.
Yeah.
So that's why.